also, okay?
Okay, it's for Mustafa Hamad, Nasriya guy. Yeah, he's
Okay, thank you so much for your ceremony. That was great. And thank you for everything. Especially these were great, and this time we go for continuing. We have only two subjects in this today, and because of your ceremony. And yes, maybe I get up to 9, and you're responsible for it. Okay, what did you see here? Pay attention to the place. Hyaluronic stenosis. What do you think about? What happens when you have stenosis in some places?
Obstruction.
Obstruction.
You cannot go to the test.
Okay? No. Not mixing all of things with each other. This is HPS, hypertrophic pyloric stenosis. Okay? No. Pay attention, I will say to you. Okay? This is related to hypertrophy of muscles in the pylor, and you had stenosis. Okay, we say hypertrophy pyloric stenosis or HPS. Okay, that's very simple. Is a condition in infants where the pyloric muscle thickness, okay, muscle said to causing gastric outlet obstruction. Okay, is it clear?
Muscle of the doctor.
Is it clear? Muscle of the pillar. Where was pillar? This is pillar. Okay, the muscle of pillar thickness and led to obstruction. This is simple form. And this is esophagus, stomach, and pillar, duodenum. And this is enlarged pylorus, led to pyloric stenosis. Okay? This is abnormal thickening of pylorus led to HPS. Usually in 2 to 8 weeks old happen. Pay attention, GERD is not related to this age. 2 to 8 weeks, they are neonates.
Dr. Tajalli says that some neonates have GERD with this age.
That's rare.
Yeah.
That's rare. GERD is, the age of GERD is more than, and that's regurgitation. Something that Tajalli says is regurgitation.
Yeah.
Regurgitation is different from
Yeah.
GERD.
Yeah.
Pay attention,
Yeah.
that is regurgitation.
Yeah.
It's usually in 2 to 8 weeks. They are like a neonate. They are small babies, okay? That's HPS. More common in firstborn males. Like many of pediatric disease in boys is common. Why?
We don't know.
Where is Baqir?
they're cleaning up.
Where is Baqir?
Absent. Get a lunch.
No, they're
We
cleaning
need
up.
the food.
Even he's so
Yeah.
More common is firstborn males. Why the boys get some disease more?
Doctor, because of some
Because-
unknown, they're eating.
The G's.
That's unknown. We didn't know. Why they both get some, this is more like HPS.
Because the boy throw down women. So.
That's
God did
unknown.
that.
That's unknown. Pay attention. Increase with family history.
Yeah.
My confirmation is I'm family. Okay? Maybe some students that say to me, you are hated of family because of these genetic and these family history disease that we have in pediatrics. Maybe happen. What's the sign? Number one, vomiting. Whenever in GI you have obstruction, you have vomiting. You have regurgitation. Okay? Number one. Number two, that is a final exam question, is olive-shaped mass in the right side of the abdomen. Final exam question. Don't mix this sign with each other. Currant jelly, for example, is for intussusception.
Yeah.
That was the other final exam question. Bloody stool jelly related to intussusception. But in this disease, we have olive-shaped mass in the abdomen. Related to pyloric stenosis, hypertrophy of muscles, like a mass in the right side of the abdomen. Okay? Sometimes you can see it, sometimes by sonography. Many times we confirm it by sonography. Okay? Question. I said to you all of my final exam question.
Maybe you have a 100 question.
Yes, maybe. Okay?
Doctor, we can rely on the sequence that you say.
Yes.
So
Read more files
Yeah.
and check them and pay attention to something that I said about final exam question. They have bilious, but not related to this part mass sometimes. Pylorus. This is pylorus.
What is
That's,
the olive shape? Where
this is a round shape. This is a round. In radiology sign, radiology say that is like an olive. It's too small, like an olive, because of small. Not very large as a tumor. It's very small. Diagnosis by ultrasound and barium study, that is rare. Especially ultrasound is very, very good situation. Barium study, sometimes they give barium to eating to the neonates, and you can see a stenosis, obstruction. Okay? What do you think about treatment?
Surgery by
Treatment.
opening
Balloon.
Balloon.
Do you think balloon is useful for?
Maybe
Doctor, there is thickness in the muscle.
Should better that remove this hypertrophy.
Yeah.
Okay? Balloon not useful for them. Pyloromyotomy is a surgery that is doing for them. The surgeon opened the abdomen and the hypertrophy muscles is removed. We say pyloromyotomy. Okay? The muscles remove that they have hypertrophy. And you as a nurse correct flow, electrolyte, imbalance, before surgery, after surgery, and doing some checking vital sign, intake output, and all of nursing cares that you do in surgery wards is for them too, okay? Preoperative, for example, keep infant NPO, IV flow, electrolyte correction, NG tube for decompression, monitor intake output and daily weight is common. And post-operative is gradual reintroduction feeds for the mothers, monitor vomiting, pain management and wound care because of infection. Pay attention to them.
What? Infection, wound care.
Because the wound is open and maybe led to infection for them.
Yeah.
You have gone to surgical ward in medical surgical
Yes.
internship.
Yeah.
Some
You
did.
do anything?
No, only observation.
Cesarean section also.
What?
For cesarean section we observe.
Okay. Only observe?
Yeah.
Changing dress, no?
No.
Sometimes observe,
Uh,
sometimes.
change dressing every 3 days.
No.
For us, we don't do any wound dressing because
Oh.
The cesarean section.
they don't let us.
No.
Yeah, because we are students.
After a which time?
Doctor, depended of the doctor.
Kind of surgery. No.
If you go to the ward, ask of CTA that please do this by me.
They just say, I am a nurse, just come and observe.
Yeah.
How do I do
Just
wound
doing
care?
vital signs.
Yeah.
Okay.
At Al Hospital, me and Barakat, she's absent. So the instructor in Al Hospital allowed us to do wound care ourselves, and she guided us. But we
Okay.
showed her the initiative. We showed her that we want to learn, and we showed her that we're capable of doing it.
Okay.
So she let us.
You will do in this term or maybe the next term.
Yeah.
Don't worry.
Doctor, how much time will it take to remove this, change the dressing? What dressing?
Based on the doctor's prescription,
Approximately.
sometimes, for example, you have a appendectomy that's rupture. The baby had poor secretion. Maybe every 2 hours you're forced to
I mean
change.
from the first time.
Okay.
From the first time.
Oh,
The
okay.
patient post-operation.
Okay. It
Post-operation.
also based on doctor's prescription.
24 hours.
For example, some surgeons say 24 hours, not change, based on the operation. For example, you go to neurosurgery ward, the brain is opened,
Yeah.
and they have changing not as usually in the surgical ward. It's based on doctor's prescription. We couldn't say absolutely what time. It's different. For appendectomy that is rupture, it's different. For simple appendectomy, is different. For about brain tumors, is different. For orthopedic situation, is different. Please see the documents of the doctors. Pay attention. And this is pyloric muscle that after surgery they decrease the pressure and okay, finished. Do you have any question about HPS?
No.
Olive sign?
No.
Do you have any question?
No. Everything.
Okay, okay. What does this mean in Arabic? Grammar. Okay, I say if I have time, I search everything in Arabic and also say to you with each other to be easy for you.
Doctor, it's
Is
easy.
this?
Already it's easy. We
What?
haven't get it.
You are very kind, doctor.
Very kind, yes. No, I'm not kind.
Doctor, international student. You can speak
Yes, yes, I am speaking English. Don't worry. I wanted to speak some special words in 2 languages, okay? Okay? For example, this is, what is this, Mahdi?
Flow.
What is this? Width. Width. We wanted to speak about celiac disease. Do you know?
Yes.
Celiac. You read it?
Yes,
Yes.
Okay.
But not for pediatrics.
Okay.
It's for pediatrics.
No difference between pediatric and adolescent because this disease is a chronic disorder and related to family, to genetic.
Yeah.
You have this disease from the birth.
Yeah.
That's related to genetic.
Yeah.
Not difference between you and adults.
Yeah.
Pay attention. Celiac disease is a chronic disorder where ingestion of gluten, you know, gluten found in wheat, barley, and rye. You know, what's you say in? Do you find this or no? Search in Arabic for yourself.
We know.
The types of
Wheat, barley, and rye. Do you find it? Search it in Arabic for yourself. Because Mahdi know in English. Okay? Sha'ir and
Can you have like sensitivity to, for example, only wheat but not barley?
pay attention. It is related to intestine
Yeah.
of gluten. Digestion of gluten isn't possible in the intestine of person that they have celiac disease.
No, I meant, can you have gluten intolerance, for example, wheat gluten intolerance, or barley gluten intolerance, or do you have to have all of them at the same time?
All of them at the same time. All of the same time. Damage the small intestine villi. Why? Because the intestine doesn't digest gluten and led to diarrhea, and they have malabsorption, they are failure to chew, and they have problem from the neonates.
Doctor, the baby born with this disease, celiac
Yes.
disease, my cousin is 14 years old,
Okay.
and she feels sick, and go to the doctor, and he diagnoses with celiac disease.
How? I will say to you, I will say. They are damages in small intestine villi leading to malabsorption. They are diarrhea. Stature means kinds of diarrhea. That's, you can see fat drop on that. Some books says that is related to immune system also. For detecting, sometimes the doctor do some lab test about immune system. For example, checking IgI, that's related to disease also. But for detecting and sensitivity to this substance, sometimes you check at the first go to signs and symptoms. Chronic diarrhea, pay attention, number one. And smelling full and bubbly stool. They have these malabsorption patients have these signs and symptoms, especially in about this one. Greasy stools. You can see fat drop in the stool. They have fatty stool. Malabsorption like celiac. They have steatorrhea. Do you hear this word? Steatorrhea.
No.
Steatorrhea means diarrhea, full drop of fat on that. Stool of full of fat, we say steatorrhea. That is full of foul and bucky smelling. Too bad smelling. The stool of these patients is abdominal bloating and pain and vomiting in children. They have malabsorption because of gluten. They are sensitive to gluten. Failure to treat. They have failure to treat. What is failure to treat means? Growth reduction. The weight is lower than normal, the height, and also loss and anemia. Why they have anemia? Digestion is decreased and they have iron deficiency anemia. Fatigue and delayed puberty, bone pain, osteopenia, all of them because of malabsorption of vitamin D and all of vitamins not absorbed. These are in this position, you can see them, distension of the abdomen, and they are thin. Diagnosis. Biopsy is the best one. Maybe your family has done biopsy and confirmed celiac.
But in lab test.
Lab test, yes. Also
I
some.
think for IgG. The
Yes.
purpose, but she don't have any sign of symptom the last years. She's 14.
Yes, maybe.
Just
Because pay attention about celiac, maybe mild, moderate, or severe. Okay, maybe it is moderate.
Yeah.
Maybe you have severe.
Yeah.
This related to kinds of the disease, and sometimes you can get some genetic test. Genetic test is also useful. Biopsy of small intestine is useful, and also lab test.
There are studies that show people are more susceptible to celiac disease nowadays because of genetically modified wheat and seeds.
Mutation of the genes, maybe. Mutation in genes in the children period, not after birth. For example, you get in this age celiac disease. It is possible.
They genetically modify wheat to make it, more. To grow more wheat, they genetically modify it. They make it grow faster. So that is making people more sensitive to wheat.
Maybe.
So it could be the case for her.
Maybe, but in most cases we have gene and we have family history of this disease. Okay, pay attention. And for diagnosis, you can take biopsy, genetic test, and also lab test, and check some antibodies, IgI, IgG, led to doctor's prescription, for confirming to do them. After confirming, what do you do?
Diet free of gluten.
Gluten-free is the most important for them, and you as a nursing monitor growth and weight, assess nutritional deficiency, educate family on gluten-free diet, encourage label reading on the foods, on the milks, okay, that about gluten, everything should be gluten-free, and provide emotional and dietary support for these children, okay, because this is too hard for them that living with gluten-free everything. The substances of gluten-free are too expensive. For example, the milk is too expensive, and every product that's free of gluten are too expensive for people. Okay, do you have any question about gluten, I wanted to check if I have some question in my flash. solve some of question with you if it is open.
Press on the just one.
I don't know.
Just
Just
one.
the video.
Just one.
So, yeah.
I try to open.
This
This is not related to you.
next has a question
The
for us.
questions,
Okay, I wanted to check.
the cards.
Can I help you? If you want?
Let me, I wanted to see this question.
It's okay.
It's not related to you.
You want to close it?
Yes.
It's
This is related, we have an international student in Iran, it's related to them. I wanted to,
question.
I think it's the last one, isn't it? No, the first. Yes.
Question. Let's just ask.
these are samples. Open it.
No, no. Excuse me.
Pay
I
attention.
should.
Okay, for example, some of my question is number 1, please read it.
Me?
Read
Why we
it.
have
Okay.
changes in
I
that?
said-
Why we have a change in thalassemia children?
I said to you about my question, example. These are example, okay?
You tell us what the
Please
case
read
is
the
called.
files. Number 1.
Can you send the file to
Why
us?
we have changes in thalassemia children? A,
Lower HB.
lower hemoglobin, because of hemolysis. Number B, C, because of hepatosplenomegaly, and D, because of iron overload. You can sit down. No problem. What was the answer?
HB showdown.
You sit down, no problem. Okay? Do you find the answer?
Yeah.
Pay attention at the first, read carefully the question. This is a sample. Pay attention. I wanted to say to you some sample for reading the files carefully. What's your question? What?
Yes.
No, not send. This is only reading the class. No. You can take a picture, no problem. These are samples.
We want to take a video.
Video, no, because the question is determined and answer is also. Take picture. Number 2.
Number 2.
What is the best chelator? That's right. I said all of my question to you. These are samples. Pay attention. Read all of the choices. Number 1, Osperal. You know Osperal is also a chelator. And penicillamine is also a chelator.
The best this is the question.
What? These are samples. These are samples. My question, these are samples, and I provide your question like them. Okay? But not exactly this. I wanted to share with you how you do choose the, for example, A, B, C, or D. Because all of these are chelator. Which one is the best? Because of it. What is the best way for injection of desferals? We have also IV, we have also ID and IM. Which one is the best? Subcutaneous. Pica is, you know Pica is?
Yeah, I think something is weird Period. Not
Eating,
for
breastfeeding, sign of iron deficiency, eating ice and soil,
Yeah.
and D, B and C are correct. Which
Yeah.
one?
Deficiency, iron deficiency, and eating something weird like ice cream.
Number 6, rodent face is seen in what disease? Hemophilia, thalassemia, iron deficiency, and ITP. Which one? Pay
Thalassemia.
attention. In this file, answer is red, but pay attention. Think about the choices. What is hemocirrhosis? What is the hemocirrhosis? Please read the choices.
Iron overload with the cell destruction.
Okay.
Iron deposition with cell sugar overload.
Which one?
Iron deposition.
Without cell destruction.
What was with cell destruction? Hemochromatosis. Maybe this is my example. I say about hemochromatosis. Pay attention to that. Okay, the next next question is what is hemochromatosis?
Iron overload with cell destruction.
Cell destruction. Pay attention. These are example of my question. Not specially this. I changed them, but aim is this. What is minor of alpha thalassemia?
2G, not
Mazel, I'm saying to you, final exam question. Look at. Please say the answer. Please say the answer, Fazil. Ah. For example, it is minor, maybe I say major. It is minor, maybe I say H disease. Okay? The kinds of my question is like this. Right? If we speak about alpha, the question is about alpha. Pay attention. Maybe in the exam I say beta. Okay, pay attention. Hazel, say to me number 10. Hydrops fetalis is you come to my class without class.
Watery baby. Watery fetus.
Hydrops fetalis is
Thalassemia. Watery.
okay. I show the picture of Hydrops fetalis, watery fetus.
Yeah.
Do you remember? That's related to
Thalassemia.
thalassemia. Which thalassemia, for example, my question should be about the kinds of thalassemia. Which kind?
Major thalassemia.
Alpha. Pay attention. Alpha. Number 11. Common signs of hemophilia is number 1, hemarthrosis, epistaxy, purpura, bruising. Which one? Which one? The best. Please select the best choice. Which one is the best? Hemarthrosis. When we speak about hemophilia, we speak about hemarthrosis. Puzzle, look at me, pay attention. These are final exam question. Common form of hemophilia is classic is
Yeah, the type 1 genetic 8.
you are decreasing factor 8. 8 and 9. Which one is
8.
common? 8. 8 is classic.
Classic.
Rice is
Rest, eyes,
Okay.
C is compression, and E is elevation.
okay. Which one is
A for
nursing care of hemophilia is number 1 rice, number 2 bed resting, C controlling vital sign, D operation joint as soon as possible. Which one is correct?
Rice.
Rice. What is PBS? Do you know?
no.
what is PBS? Peripheral blood smear. For detecting hemophilia, for detecting cancers, for detecting thalassemia, and a test for CF. Which one? Cancer, okay? We explained about PBS for you, okay? Peripheral blood smear. Pay attention, in this test, abbreviation is, don't miss it. It's about peripheral blood smear. Pay attention. And number 15, what is triple IT? Do you know triple IT?
Yeah, we talk about it.
A test for detecting ITP,
No.
a treatment method for hemophilia.
No.
Use 3 drugs of IT
Yes.
cancers of children.
Yes.
And these, all of them is correct. Pay attention, maybe some of the tests, all of them is correct. Is it all of them correct?
No.
No. Number 16, what is the cause of ITP? Viral infection, autoantibody against platelet, unknown, all of them. Maybe some of my question is all of them. Pay attention. Treatment of ITP is antibiotics, chemotherapy, radiation therapy, none of them. Maybe some kinds of my question is none of them. Maybe some of all of them. Number 18. These tetrads are related to what disease? Purpura, renal disease, abdominal pain, arthralgia. Do you remember about what disease we had?
Yes.
What was it? Check, sometimes you don't know the answer. You check the A, B, C, thalassemia. Is this related? Hemophilia? No. And go to ITP and Henuch. Henuch. Why Henuch?
Because the renal failure is happening.
Because we had
Renal
the
failure.
renal disease pain. Pain. Because of vasculitis, we had pain. Okay. Do you find it? Factors affecting the spread of congenital heart disease are, today I spoke about them.
Yes.
Factors affecting congenital heart disease are maternal rubella
Yes.
in the first semester of pregnancy, alcohol consumption, cigarette smoking, hubble bubble, genetic factors, all of them.
All of them.
Maybe of my tests, maybe all of them, okay? Or none of them. Number 20, in what CHD you have high blood pressure? Today I said to you,
Yes.
high blood pressure.
Yes.
You remember?
CO.
Pay attention, maybe you don't remember. Check the ABCD, ASD.
No.
We have high blood pressure? No. VSD, we have high blood pressure? PDA, we have high blood pressure? No. The D is correctation of aorta, that is with hypertension. Okay? Go to 21. FTT is seen in what disease? More. Thalassemia, CHD, hemophilia, or ITP? Which one? Thalassemia. FTT means failure to treat. Growth decretion. Growth decreased. Pay attention. In what disease you have FTT? Heart disease. Hemophilia are normal person. Thalassemia are normal person. ITP is normal without any FTT, but something that's happened, CHD, congenital heart disease, it means FTT more. What are cyanotic disease? I said you morning, okay? What are? Number 1.
Increasing pulmonary outflow.
When we have decreased pulmonary blood flow, when we have increasing pulmonary flow, when we have increasing white BC, when we have decreasing platelets.
No, the first one we explained.
Check the A, B, C, D, okay, and decide about which one is the best, okay? Cyanotic disease is related to cyanotic heart disease, okay? And number 23, what is sinus venosus defect? I said to morning. Sena, do you read them and say sinus venosus?
It's one kind of VCD, it's one kind of PDA, it's one kind of TOF. None of them.
Actually,
It's none of them. Because
What
we
was
don't
the sinus venosus defect?
upper part of arterial.
Okay, that was a kind of ASD, atrial septal defect.
Yeah.
Remember, pay attention.
Yeah, it's
And BSD no, PDA no, TOF no, none of them.
yeah.
You don't have ASD here, okay? Atrial septal defect. What is left to right shunt in ASD? You know? ASD.
The movement of blood.
Blood flow from left to right.
Yeah.
Blood flow from
Yeah.
right to left, decreasing blood flow, increasing oxygen.
No, from the left.
Shunt
Shunt
means
is movement from
movement of
left
left
to
to right.
From high blood pressure to low blood pressure.
Do you find what is PFO? PFO was a kind of ASD. In the middle, you have a hole between two arteriole, and you have ASD. A kind of ASD, that hole is the middle. A kind of VSD? No. PFO is a kind of ASD. Number 3 is minor alpha thalassemia. PFO, patent foramen oval. And D is minor alpha thalassemia. Which one is correct? A kind of ASD. Pay attention, these are samples.
Can you try to decrease and final some abbreviation that we confuse?
Okay, I wanted to, I am saying to you examples to pay attention to abbreviation, because in the ward, in documents, the doctor said PFO, not abbreviation, okay? They say what is ASD, what is PFO, okay? You pay attention and know about abbreviation. Number 26, what is umbrella device? What is umbrella? Do you remember what was umbrella?
For the hole.
Okay, for closing ASD and ESD. Okay, do you remember? We go to the ABCD. A device like umbrella for closing holes in the heart.
Yes.
Number 2, a device like umbrella for closing ASD,
Yes.
for closing BSD,
Yes.
all of them.
Yeah, all of them.
All of them, pay attention. These are examples. Number 27, when did we do surgery for BSD? Number 1, should be monitored if not treated by the age of 1 month. Surgery, no, this is not correct. B, should be monitored if not treated by the age of 1 year. No, 3 year, okay? Should be monitored if not treated by the age of 3-year surgery.
Yes.
Okay, all of things I said to you, and you can find in my files.
Yeah.
Okay, pay attention. And number 28, squatting position is related to squatting position. Cyanotic disease, and which one was the most common cyanotic disease? Tetralogy are followed. Pay attention. We go to see the ABCD. Ostium primum,
No.
TOF, sinus venous, or ostium secundum. You know ostium primum, ostium
Yes.
secundum,
Yes.
and sinus venous
Yeah.
are related to atrial, ASD, okay? But everything is about TOF is cutting position, okay? Number 29, boot shape heart is
For your
boot shape. I showed to you boot.
Enlarged heart.
What disease?
Enlarged heart.
What disease?
It's
Disease. TOF. Boot shape heart is in number 1 TOF, number 2 ASD, VSD, correctation of aorta. Which one? TOF. Pay attention. Abbreviation. Okay? Learn. These are easy. Number 30. The nurse is planning educate to family of a child newly diagnosed with hemophilia. Which long-term complication will the nurse include in the teaching? Number 1, intellectual disability. Number 2, joint distraction. C, recurrent pneumonia and heart valve injury. Which one about hemophilia? Joint damage, okay? We have hemarthrosis for them. Okay, in long term, hemarthrosis led to disability for them. Something that you teach to them is joint distraction. I think finished. Finish my file. This is some examples of my question.
Thank you.
For guiding to read the files and look at the something that I said in the class. For everything, for about intussusception, for about HPS, I said to you some keywords about final exam. Pay attention to them and read them. And if you have any unclear things, ask me tomorrow because it's the last session that I have with you. I don't know what date is your exam, okay? You know?
And then next semester,
Oh, next semester?
Yeah.
What date?
we don't know.
a week after we start.
And
The
then
first
first
semester. So
Okay.
a week after.
Please read more and pay attention, especially about Tajali's file because she says case. Yes, case. But for me, I wanted 2 points, important points of it. Okay.
Files, doctor. Files. Doctor, files. I wanted to go out. Locker. Locker.